Hello guys, welcome back to my channel Religiously Fit. I'm coming back after such a long time. I'm really sorry for that. I was caught up with so many other things. So when we started making these videos for my YouTube channel and for the people who are going to take up the exam, ACE exam, so we completed 5 chapters of ACE Personal Trainer Manual 5th edition, and now today we'll be starting with the 6th chapter, so which is building rapport and initial investigation stage. Okay, there's some glare coming on my specs. Okay, so quickly I'll go through the contents of this chapter, which are facilitating change and motivational interviewing, health risk appraisal, evaluation forms, health conditions that affect physical activity, medication, sequencing assessments, choosing the right assessments, tools to get started, conducting essential cardiovascular assessments, ratings of perceived exertion, this is an important one, and the exercise induced feeling inventory and the summary. So again, as I say for every chapter, that this is also a very important chapter. It is kind of quite a bit lengthy chapter, but I'll try my best to keep it within 20 to 25 minutes. Okay. So first of all, we start with the first topic of this chapter, which is repo. What is repo? Repo, I'll say the definition. It is personal interaction between a trainer and a client. Basically, it's a personal interaction a trainer establishes and maintains with a client. It requires effective communication as well as mutual respect and understanding. So this basically has 3 attributes, which are empathy, warmth, and genuineness. I'm not going to detail out these concepts because these are self-explanatory. Okay, going to the next one is building rapport. How do you build rapport? Rapport can be built in the first stage when you are meeting with your client in the, like first time, or it's not a very hard and bound rule, something like that you have to maintain. You have to create that rapport in the first stage only. It can be developed. It can be you know uh, progressed upon during all these stages of client trainer rapport building. So first is rapport, in which you try to put impressions and you try to develop trust and create warmth between you and the client. The next is investigation, in which you try to identify the readiness of the client to change their behavior. Then comes planning, in which you do the goal setting, programming, motivation, and adherence strategies, like we discussed in the earlier chapters. Then comes the action stage, which is the last stage, that is instruction, demonstration, and execution of a program along with proper feedback. So this rapport building can be done in the first stage, in which you are meeting the client for the first time, or during all these stages. Okay, and practically, if you ask me, it is being progressed upon. It is incremented. It is done incrementally along these all these 4 stages: planning, investigation, rapport, investigation, planning, and action. Now comes the style of communication. There are various styles of communication like preaching, educating, counseling, and direct style. So these all have their pros and cons. Okay. But the type of style which is recommended in as per ACE is the counseling style, in which you have to be like supportive, collaborative, in order to probe and solve and help them to make informed decisions. Most effective style of communication, and this is recommended when implementing a plan or modifying a plan or program design. Okay, this is not that important, not very much important with respect to the exam, but yes, you should know like how to counsel, how to educate your clients. You should not preach them. They are not your students. Okay, so allow them to take their own decisions. You have to educate them with all the knowledge. Okay. Now comes the next topic, which is pre-exercise question. This is a very, very important section as when it comes to your training, because if you want your client to achieve their dreams, and also you have to understand like their behavior, their nature, their habits, everything. Okay, so that all will be covered under this stage. So I'll say the definition because I have written the formal definition from this book into my notes. Ask how their typical week looks like, what physical activities they do, business activities such as traveling, time spent away from work, recreational activities, pain during movement. So these are all things which you try to get from the client in the rapport building stage, or maybe in the planning phase sometimes. Find as much as possible about their lifestyle, habits, and exercise history, so that you will get more clarity on what program design can will work in the best way for that client. Okay, bringing changing and motivational interviewing. Okay, so motivation interviewing is an important concept with respect to exam because they ask you questions and they ask you that this type of questions belong to which phase of client training relationship model. So you have to tell them that okay, motivation interviewing is done in, I think this was done in the investigation phase or in the planning phase. I'm right now confused, but I'll answer this correctly in the latter part. So motivation interviewing is client-centered method for building intrinsic motivation to change by exploring and resolving mixed feeling about their health and exercise habits. Helps determine if client is ready for change, or it helps you to determine the current stage of change. Okay, we'll be going through the current stages of change. I think in this chapter only. Okay, okay. So then comes the health risk appraisal, which is basically pre-participation screening. It helps you to identify the signs and symptoms for cardiovascular diseases, pulmonary or metabolic diseases. Okay, identify the risk factor, the positive and the negative risk factor, which we will be going through in a minute or two in this chapter, which is very very important in the client assessment and as with respect to exam as well. Then under this pre-participation screening, first, as I said, we'll be checking do they have any history of cardiovascular, metabolic, or pulmonary diseases. The second thing is risk factor. The third thing is the PARQ. PARQ is physical activity readiness questionnaire. It is basically a kind of questionnaire. You can say it's a high level overview of screening. Like it is quick, easy, and non-invasive. It is but it has a downside, that is it lacks in detail. It's not a very detailed form, but it's kind of you'll after when a client fills this form, you'll be able to get to know that they do have any disease or all those history kind of thing. Okay, now comes the risk factor. Risk factor is a very very important topic. As I said earlier, risk factor will tell you that the client it will tell you the status of the client with respect to the severity of their of risk they are having right now with respect to their health. Like I don't be scared with this. I'm not able to explain that much in a better way. But as we progress, I think this topic will be clear in your mind. So if your client is if your client's age is plus 45 plus for men and 55 plus for women, then it adds plus one risk factor. Okay, you just try to just go by my okay, I think I messed up this video. No, but I'll go ahead. If they have any family history, like if they have any heart attack or something like that in their family, on their father's side or their mother's side, then it is again a positive risk factor. If they're smoking cigarette from last maybe 6 months, within 6 months, or like they have quit smoking cigarette within 6 months, or they are right now smoking cigarette, then it again adds plus one to risk factor. Like if they have sedentary lifestyle, not doing 30 minutes of exercise in 3 days for 3 months, it again it's a plus one. Obesity, like their BMI is 30 plus or their waist is 40 inches plus for men or 35 inches plus for women, it is again a plus one. Hypertension is like 140 plus, it's a diastolic. Sorry, 140 plus is for systolic, and di is 80 plus, 90 plus. Okay. No, because I think when I gave my exam in this January, they changed it. They changed these numbers, systolic and diastolic. So you have to refer to the current edition of ACE Personal Trainer Manual, because this was as per fifth edition. So you have to go through for the sixth edition. Otherwise, you will lose marks in the exam. If they have dyslipidemia, in which the LDL is 130 plus, or the cholesterol is less than the HDL, the good cholesterol is less than 40 milligram per deciliter, then it is again a plus one. If they are pre-diabetic, like their fasting plasma glucose is 100 plus, again this also I think you have to check with the latest one. I'm not sure. In the sixth edition also it was 100 plus milligram per deciliter for fasting plasma glucose, but less than 125 milligram per deciliter. So this is again a plus one. So if your client is like now, as per these risk factor, if I add all of them, 1, 2, 3, 4, 5, 6, 7, 8, these are 8 risk factors. Okay. So now I'll be classifying these clients on the basis of number of risk factor they have. Like if a client is said to have at low risk, then that means they are asymptomatic, they have less than 2 risk factor. A medical exam before moderate or vigorous exercise is not needed because they two risk factors are less than 2. Okay. But if the risk factor are more than 2, then a medical exam for moderate exercise is not needed, but medical exam for vigorous exercise will be needed because their risk factor are more than 2. So then they will come under moderate category, moderate risk. And if they are classified as high risk, then that means they are symptomatic, or in other words, you can say they have cardiovascular disease, pulmonary, renal, or metabolic disease. Second is, I'm sorry, Second is the medical exam before moderate and vigorous. Both the exercises, medical exam is necessary because they have risk factor that is more than 2, and plus they are symptomatic. And doctor supervision for both submaximal and maximal exercise test is recommended. Okay, because they are under high risk, because they may get a heart attack or they may run into some serious trouble when they are doing some moderate or maybe vigorous exercise. So that is the reason now I think the concept might be clear in your mind that what is the risk factor and what is their role, okay, in deciding the program design. Okay, so now going forward, we will be defining what is moderate, what is vigorous exercise. Moderate exercise is when it is 40 to 60% of VO2 reserve, or 3 to less than 6 MET. MET, what is MET? It is metabolic equivalent. So like you are walking, you are running, you are swimming, jogging, these activities, or maybe you are doing nothing, you are just right now I'm talking to you. So this is an activity of daily living. So it will also, right now I'm inhaling some oxygen. So we have measured those numbers, like uh, for example, when we are doing nothing, like we are sitting and just talking, so I think it is 3.5 milliliter of oxygen per kilogram per something. I'll tell you the exact number. It is in my notes. I'll just bear with me. I'm really sorry that um, I'm doing this in between the video. At 3.5 MET. I'll pause this video. Yeah, I could have paused much earlier. Anyways, so 1 MET is 3.5 milliliter per kilogram per minute. So this is the average metabolic rate at rest when we are doing nothing. When we are walking, we require 2 METs. That means 7 milliliter per kilogram per minute. And when we are jogging, we need 8 to 10 METs. Okay, that means 8 into 3.5, something like that. So running requires more, dancing requires 3 to 4.5, swimming requires 6 to 11. This is important, you should know. Like running, swimming, jogging, dancing. Okay, like this. Running is the most, it requires most METs, then swimming, then jogging, then dancing. Okay, and okay. So moderate exercises when we require 3 to less than 6 METs. Okay, 3 to less than 6 METs comes under like dancing. Or maybe dancing, or maybe, no, I don't have any other example. Okay, vigorous exercises when it is 6 plus MET. 6 plus MET means when we are swimming or we are running, then that is a vigorous exercise. Okay, now what are the signs and symptoms which should be noted when like when your client is doing the exercise and it needs an immediate attention? Like there are around 9 of the symptoms, like pain and tightness or discomfort in chest, neck, jaw, arms, and other areas. Okay, shortness of breath or difficulty breathing at rest or with mild exertion, which is called dyspnea. Dyspnea. This is also, you should remember this. Or orthopnea. Orthopnea is dyspnea in reclined position. When you are like, for example, you are doing an inclined bench press, okay, and then you are having trouble breathing. So that is called orthopnea. Or paroxysmal. I'm not able to pronounce this word, paroxysmal nocturnal dyspnea. This is another name for orthopnea. Orthopnea. See, I'm not able to speak that name. Or ankle edema, palpation, tachycardia, which is also called tachycardia. Now you should have to remember these names. I know it's hard to for us, but we have to. Or intermittent claudication. Claudication is basically pain or cramping in the lower extremities, like in the legs, when the adequate blood supply doesn't runs into our legs in the lower extremities. Or they feel heart murmur, or they have unusual fatigue or difficulty breathing with usual activities, or dizziness or syncope. You also have to remember this word, dizziness or syncope. It's a synonym. Most commonly caused by reduced perfusion to the brain. So, if in case you are seeing any of these symptoms, you have to just stop your client from doing exercises and take the necessary required uh, what step, the next step. Sometimes I just forget the words. Okay, now comes the evaluation form. Evaluation form, there are so many types of evaluation form. Like first is informed consent. Informed consent, in there with respect to exam, you have to remember there will be two words. First is informed consent, and second is liability waiver. So you should know very clearly the difference between the two. Informed consent is you get a you get a like consent from the client that this exercise involves this thing, risk, some kind of risk, so they are aware of that thing. Okay. And liability waiver is a kind of contractual form which you get it signed by the client, that in case if any mishappening or any accident, something like that happens, then you won't be responsible for that. Okay. But this doesn't involve the sheer ignorance, like you are being ignorant while your client is working on it, then some accident happens, then you will be responsible, you will be liable for that. But uh, we don't take this avoidance, sheer ignorance or negligence into this liability waiver. Then comes the health history questionnaire, as we discussed in the starting of this video, exercise history and attitude questionnaire, medical release, and testing forms. So these are different types of forms. You should be aware of those. uh, they might ask you questions with respect to PARQ, as we discussed in the starting of the video, or they might ask you what is the difference between consent form, informed consent, and liability waiver. Or they may give you some scenarios and try to confuse you between these two. Okay, so you should be very much clear between the difference. Okay, now comes health condition affecting exercise. So now I'll be going through a lot of conditions, medical conditions, and these are really important. And I think these will be coming in the latter chapters also, where we will be talking about them in detail. But right now, I'll just give you a high level overview of these. So starting with the cardiovascular, under this comes atherosclerosis, yes. When the fatty deposits from cholesterol and calcium builds on the walls of arteries. So what is this? This is basically, it causes thickening of arteries, and it causes arteries to be less elastic. Okay, because obviously there's a deposit on the arteries wall, so they won't be that elastic. And this can result in chest pain, which is also called angina, which is a myocardial infarction, or in other words, heart attack. So, okay, so coming to the next, this is respiratory. This is related to lungs, obviously. Some difficulty or labored breathing. It can be bronchitis, emphysema, asthma, or chronic obstructive pulmonary disease, which is simply called as COPD. Then we have musculoskeletal conditions, like it's the conditions which are related to muscles, bone, tendons, and ligaments. So we'll be talking about sprains and strains. Sprains are basically sprains always happen in ligament. Ligament is something which connects two bone together. Okay, so ligament is present between the two bones, which connects the bone together. And strains happens when involved in the tendon, where the muscle is connected to the bone. This is the bicep muscle, and this is the bone. The bicep muscle is connected to this bone. This is called tendon. If you try to press this, you'll not feel this density or this thickness here, and you can try and check, press this area, you will feel that this is basically a tendon which connects this muscle to the bone. Okay, so musculoskeletal injuries or conditions are strains, overuse in injury, which are most common in athletes or people who are working out at gym, which involves bursitis, tendinitis, arthritis. These are all overuse injuries. Okay, so now comes the fourth condition, which is metabolic. Metabolic is disease that interfere with the metabolism or utilization of energy. So these are mainly categorized into two categories. First is diabetes, and the second is the thyroid. Okay, so last condition comes is it's other conditions, or you can call them miscellaneous, which comes hernia. This is contraindication must be cleared by the physician or aggravated by increased abdominal pressure. Okay, so Valsalva maneuver. So this again we'll be covering in the coming chapters. And pregnancy or illness or any infection, these comes under miscellaneous conditions. Okay. Now we'll be coming to the medication part. Like we have already talked about conditions. Now we'll be talking about the medications. So first one is antihypertensives. Antihypertensives are used for reducing the blood pressure and all. Okay, like beta blockers. These are medicines which limit the sympathetic nervous system. Like it blocks the effects of catecholamine, that is epinephrine and norepinephrine. These are two hormones which are responsible for regulating the blood pressure, you can say, or the heart beats. So beta blockers are taken to stabilize the blood pressure. Okay, so antihypertensive can be beta blockers, which helps to lower the resting, exercising, and the max exercising heart rate. Then comes the calcium channel blockers. These have no significant change in the max exercising heart rate and can increase, decrease, or not affect decrease or not affect resting and exercise heart rate. Okay, now comes a question in my mind with respect to exam, that beta blockers, whether beta blockers or whether calcium channel blockers increase, decrease, or they have no effect on which of the heart rate, like the resting heart rate, exercising heart rate, or maximum heart rate. Okay, maximum exercising heart rate. Now comes the third one is angiotensin converting enzyme inhibitors, then angiotensin 2 receptor antagonists, then diuretics. Diuretics is basically they maintain the increase the excretion of water and or electrolyte through kidneys. So when like bodybuilders go for their competitions, they take diuretics. So it excretes all the fluid, the water from your body, so that you look so shredded. Okay. So these also cause this water and electrolyte deficiency in your body, because of which some you have seen that on stage uh, while posing they do get cramps. Okay, that is because of the loss of sodium and potassium. Okay, now no significant, it doesn't have any significant effect on heart rate. Now comes the bronchodilators. Bronchodilators are responsible for dilating the air passage, the passage between your esophagus and the lungs. They help you to do the air exchange in a better way. Okay. Now conducting, how much is the chapter left? Okay, it's about to end and we are at 23 minutes. Probably within 30 minutes we'll be able to complete this. Now conducting cardiovascular assessment. Cardiovascular assessment, you are going to do the assessment. So first one is manual, like how can you check the first one is radial artery. Radial artery, where is that? That is here. Okay, the anterior aspect or wrist or thumb size. Okay, so this is radial artery, we normally check it like this. And the carotid artery is where? This side. If you try to just put your finger over there, you will try to feel the palpation sound. So this is carotid and this is radial. Okay, this is radial. This can come in exam. Resting heart rates. So what is resting heart rates? Like what is the slow heart rate? Less than 60 beats per minute, which is also called bradycardia. Okay. Then normal heart rate, which is between 60 to 100 beats per minute. And then fast heart rate, which is called tachycardia, which is over 100 beats per minute. So overall average is 70 to 72 beats per minute. It's the overall average between men and women. But if we talk specifically about males and females, like men and women, so for males it is 60 to 70, and for females is 72 to 80. You have to memorize these. And why this heartbeat is higher in females? Because their heart, the chamber size of heart is smaller as compared to men. The ventricles, the auricles and ventricles, auricles. Leave it. The chambers. We can call them chambers. So the chambers in females are relatively smaller as compared to men, and also the blood volume in females is lesser than males, and also the lower hemoglobin. So these are three reasons why their average heart rate is higher than men. Okay, now we are going into this conducting cardiovascular assessment. So first one was taking pulse manually, second is resting heart rates. Okay, and body positions affect resting heart rate, digestion increasing resting heart rates. Okay, obviously when you take your food, when you have your meal, after that your heartbeat increases a little bit more, because your heart has to work more to send that blood to your stomach so that it can do the digestion process, and your resting heart rate increases after having your meal. Okay, okay. Procedure for measuring exercise heart rate is you have to measure pulse for 10 seconds and then multiply the beats by 6. There are various ways, like you can check your beats for 15 seconds and multiply it by 4. Maybe for you are taking for 10 seconds, then multiplying it for by 6. Okay. Okay, now blood pressure. How do you check your blood pressure? There's one sound called Kort Kortkov, KOROTKOFF sounds. These sounds are made from the vibration as blood moves along the walls of vessel. You have to remember this name, Kortkov sound. What is the sound? Sound made from the vibration as blood moves along the walls of the vessels. And obviously, we know we take the blood pressure from that machine. You have seen that machine in a clinic, in a physician's office, physician's clinic, which is called, I am again not able to pronounce this name, sphygmomanometer something manometer. You can Google this. I'm really sorry. Okay, now comes the last topic of this chapter, which is the most important thing, which is called ratings of perceived exertion. Like if you have a client who is suffering from maybe pulmonary disease, or maybe some renal disease or cardiovascular disease, uh, uh, you can't take their measurements from a device or something like that. Okay, for these people who are having some heart related issues or some other critical issues, like whose risk factor is high, who are symptomatic, and whose risk factor is more than 2 or more than 3, for them we use this concept of ratings of perceived exertion. Like how much fatigue, how much exerted is the client feeling right now, what is their perception. So we have divided the scale from 0 to 10, and uh, 0 to 10, but right now in my notes I have written the Borg scale, Borg scales. So there are two different scale. One is the normal scale and the other one is the Borg scale. Borg scale starts from 6 and goes till 20. So if the client says he's running on a treadmill and he says that you ask him how fatigued, how tired, or how exerted are you feeling, and they say I'm feeling at 6. So that means nothing at all. They're not that tired, and the heart rate is around 60 beats per minute. It's an approximation. If they say 12, then it means strong. Strong means they are very tired. Okay. Heart rate is around 120 beats per minute. And if they say 20 or maybe close to 20, maybe 18, 19, 20, then it's very, very hard, and the heart rate is around 200 beats per minute. So likewise, in the other scale, which I was talking some time back, it starts from 0 to 10. So 0 to 3 is very easy. Nearly 5 to 6 is hard, and 7 and above is very hard. 7 and above is very hard, and 9 and 10 is very, very hard. Okay. So when we will be talking about the ventilatory thresholds, we will be discussing about the rating of perceived exertion. So here comes the chapter end. we have completed the chapter successfully within 30 minutes, 29 minutes and some seconds. Okay, thank you guys for watching this video, for bearing with me this long. I hope it was helpful. Please do write your comments so that I'll be able to know that what I need to. I'll also get a feedback, so I'll improve my content from the next time. And I hope it helps. And I'll be coming very soon with the next chapter, that is chapter 7, the most important chapter of this entire book. Okay, so see you soon. Bye bye.